begin treatment immediately.
You'll need to follow up in the clinic in 5 days.
Where should I go?
You'll have a 1:30 at Clinic C.
Take the elevators to B1 and follow down
We'll
the
schedule
hall.
the surgery.
Will I see my kids grow up?
Rhabdomyosarcoma is a
This type of
fascicle.
cancer is
I have
high.
5
Following the
appointments
transplant,
today.
the anti-rejection drug.
I never thought this would happen to me.
When you go through something like a cancer or any kind of medical diagnosis that's all brand new to you, being a patient is not easy.
They come to us scared. They come to us frightened. They look at this huge monolith that we have, this hospital complex, and they say, wow, what am I coming to now?
As a staff member here at the University of Michigan Health System, we each have a job to do, and we take our jobs very seriously. But it's often easy to forget that what's a normal day for us is hardly a normal day for the patients we serve. Each one of us, regardless of our job title or position, makes a difference every day in the lives of our patients and families. Creating the ideal care experience for each and every patient must be the goal of every member of our team.
Taking care of patients is a privilege because patients let you into their lives at the most vulnerable of times. And if we respect that deeply and understand that it's a privilege that we're being allowed, the experience is enriched for both the patient and the provider.
We all know the golden rule is to treat others like you want to be treated. Patient and family-centered care at the University of Michigan is about the platinum rule, taking the extra time to find out how each person, each family wants to be treated and going the extra mile to bring them their ideal care experience. An integral part of creating service excellence is rooted in how we interact and communicate with those we serve and with each other.
When patients and families are challenged with illness, they know they need to be away from home seeking medical care. But that doesn't mean they want to be here. That's just one of the reasons it is so critical to create a culture of caring here at the University of Michigan Health System.
It is very important for staff to remember that despite how far we've come technologically speaking and scientifically speaking, they're still managing people and they're not managing machines. The more we incorporate patient and family-centered care principles into our everyday, not just behaviors, but into our culture, the more we're going to be able to reach the needs of our patients, our families, and our staff.
It could be something simple as saying, I'll get that for you. No, I don't need to ask anyone else. I can get that for you. I'll do that for you. Or yes, we can versus I don't think that we can do that. Or let me see if we can do that.
Okay, thanks.
It is important that you feel comfortable here and you feel like you have kind of like a family away from your family. And it's with everybody who comes in contact with you. It's not just the nursing staff, it's the people who bring you your meals and the people who clean your room because they see you every day.
We're here first and foremost to serve our patients and families, but we're also colleagues and customers to each other. That's why this culture of caring must extend to our staff, how we treat each other, and how and when we share patient information.
All staff should have a level of professionalism when working here. The University of Michigan is a world-renowned institution, and we're all on display here. Patients are around every corner, and we need to be sure that we're understanding that and protect patient privacy, and always be professional.
One thing that can be very disconcerting, I think, to a patient is to be involved in a healthcare setting where they sense tension between members of the healthcare providing team. Any tension can be misinterpreted as being problems that the healthcare team has in working with each other, and that will create an automatic barrier in communication with the patient, and it will be a step in the wrong direction in creating patient satisfaction.
Do not have private discussions in public places. Don't talk about work issues when patient might hear even a snippet of the conversation. They'll assume something's wrong. Avoid excessive laughter in public, especially in sensitive locations where patients are managing critical health issues. Wear appropriate professional attire and wear your identification badge at all times, making sure it is easily visible and above your waist. Take pride in your surroundings and care for them. If something needs to be done, do it, or make sure that the task is covered by the appropriate person. And always think safety first. If you see something that appears unsafe, fix it, or bring it to someone's attention immediately.
Regardless of what your job is, the bottom line is we're here for the patient. We all have a special role, and when we work together as a team, it works out perfectly. It's like a puzzle. When you put all the pieces of the puzzle together, it's a perfect picture.